Hyperthyroidism. Thyroid gland is a butterfly-shaped organ located in the base of the neck. The thyroid has two lobes. Main hormone is T4 and T3. It regulates metabolism, heart rate, the rate at which our body uses fat and carbohydrate, produces calcitonin, a hormone that helps regulate the amount of calcium. Dysfunction of the thyroid leads to too much T3 and T4. With the overactive thyroid, the body metabolic rate can increase, causing unintentional weight loss as well as rapid or abnormal heartbeat. When T3 and T4 are too low, the pituitary gland releases more TSH and tells the thyroid to produce more thyroid hormones. When T4 levels are high, the pituitary gland releases less TH to the thyroid to slow production of these hormones. Signs and symptoms: tachycardia, anxiety, fine tremors, white pulse pressure leads to hypertension and weight loss.
Cause of hyperthyroidism happens in several different ways, but they all result in too much production of the thyroid hormones T3 and T4 in a hypermetabolic state. In the hypermetabolic state, cellular reactions are happening faster than normal. The most common cause of hyperthyroidism is Graves' disease. Graves' disease is an autoimmune disorder. This is when B cells produce antibodies against many thyroid proteins. These autoantibodies include thyroid-stimulating immunoglobulins, which bind to TSH receptor and follicular cells that imitate TSH, resulting in the growth of the thyroid gland, and stimulates the follicular cells to increase the production of excess T3 and T4 hormones. The negative feedback will not take place due to hypothalamus not being able to recognize the fake TSH produced by the B cells.
An application used to identify hyperthyroidism is immunoassay. This immunoassay consists of a novel immunosensor that is used for the electrochemical determination of human thyroid stimulating hormone based on the CPE carbon paste electrode. It produces antigen-antibody complexes which can be detected and transformed into an electrical signal recognized by a transducer. The antigen TSH was sandwiched in between the secondary antibody, which was polyclonal anti-human TSH, as well as the thyroid-stimulating hormone antibody on the surface of the CPE carbon paste electrode, which was modified with gold nanoparticles. Gold nanoparticles are biological as well as optical components, which makes it highly sensitive to diagnose assays and enhance therapies. When analyzing and measuring the immunosensor response, there was 97% sensor response towards TSH retained after 5 days and 90% after 2 weeks from the initial response. Overall, 50 nanograms per milliliter of TSH was detected by the immunosensor created.
One common treatment of hyperthyroidism is radioiodine therapy. Radioactive iodine targets only the overactive thyroid cells and not the healthy cells. Iodine enters the bloodstream and is concentrated by the thyroid gland. This treatment is taken in the form of a pill. Once in the blood, the radiation released from the iodine attacks the thyroid and shrinks it. After many treatments, the thyroid becomes smaller and is ultimately destroyed by beta radiation. A recent study was done with patients with Graves' disease. The patients did 24 hours of radioactive iodine therapy, and the levels of T3 and T4 were taken with pinhole thyroid imaging. The results concluded that there were more failures in men, and the treatment was a success in women. Overall, the results showed that a single calculated dose can be achieved in the 90% majority. However, there have been rare cases where the treatment does not work and the treatment could actually lead to thyroid cancer, so there have been a lot of questions regarding whether it is safe or not.